Thanks for joining us for this session on Reimagining Rural Healthcare Marketing. My name is Mike Milligan, and this is Amy Yaeger. We're with a company called Legato Healthcare Marketing. We're a healthcare marketing firm that specializes in rural health. And we're going to share some tips and just some thoughts with you today, hopefully some things that you can take and apply when you go back home. So before we get into that a little bit, just a little bit more about each of us. So again, I'm Mike, I'm the president of the firm. I've been involved in healthcare marketing and management, my entire career, and founded this firm in 2008. As I've mentioned, as a firm, our focus is on helping rural healthcare organizations build their brands and build their volumes. And as we'll kind of talk about today, one of the things that we've really learned, and as things have evolved in rural healthcare marketing, is that the way that maybe we used to market and build is different today than it was even 5 years ago, even 10 years ago. And there's certain assumptions about maybe, in particular, when we talk about digital marketing, what that means and how that can really be something that's very impactful and meaningful for us as rural healthcare leaders. So with that, I'll hand it over to Amy to introduce herself a little bit as well.
All right. I'm Amy. Good afternoon, everybody. I have been in healthcare marketing since 2010. I was a marketing director for a small rural critical access hospital in rural Wisconsin. And my journey then led me to starting a patient-centered medical home clinic for our facility. My peers chose me for that, and I learned a ton that really helped me to enhance my marketing skills that I returned to, because healthcare marketing was my jam and strategy and all that stuff. And Mike had reached out, and I've been at Legato for over a year. And as a former client of Legato's, I knew that they really do specialize in rural healthcare. And with my experience, we've been able to even take it up another notch, I think, with the EHR and how do we capitalize on all of that, and what we're doing in general for all things healthcare marketing for our rural facilities. So it's a little bit about me.
Thank you, Amy. So again, we'll take questions at the end, of course, as well. So just to kind of reviewing what we're going to talk about this afternoon, really just reviewing, in general, what are the tools that you can use to market yourselves, either what we might kind of consider more of the traditional types of things and what we might call more of the digital types of things as well, and kind of how that mix works best for you, and maybe even looking at what you're currently doing, and are you doing the right things, or are there improvements that you can make, or maybe just again, when you go to a conference like this, of just taking away a couple nuggets of things that maybe you say, this is something I'm going to bring back and we're going to try to apply. So that's what we hope to do today. That's really what a conference like this is all about. So also, and we'll talk about understanding what we call the difference between transactional and relational marketing, and just in general what that means and how that applies to how we market ourselves and the messages that we share with our patients and with our prospective patients. And then we'll talk about, even though we're focused a lot on the different strategies and tactics, we're firm believers in that this is all predicated and founded on having a strong, solid, strategy-driven marketing plan that's based off of your strategic plan. So we're going to talk about that and what that looks like in general. And again, when we kind of talk about quote-unquote new tools, what that means in terms of how marketing has evolved, and if it hasn't with your organization, maybe how it should evolve in your organization. So just to kind of set the stage a little bit, so this is Steve Ballmer. He was the founder of Microsoft, and I'm just going to play you this little video clip that he shared with society, I guess, the community overall, a number of years ago.
Steve, let me ask you about the iPhone and the Zune, if I may. The Zune was getting some traction, and Steve Jobs goes to Macworld and he pulls out this iPhone. What was your first reaction when you saw that?
$500 fully subsidized with a plan? I said, that is the most expensive phone in the world, and it doesn't appeal to business customers because it doesn't have a keyboard, which makes it not a very good email machine.
Was he right?
Ouch.
And in fact, 500 would be cheap now, right? So So anyway, the point obviously you see here is that, we have to continue to evolve our thinking. We have to continue to think about what could be. When it comes to rural healthcare marketing in particular, one of the things that we often see is sort of this self-fulfilling prophecy in a way that we think, okay, we're in rural health, so we can't really necessarily do what the larger players are doing. We don't have the budgets, for instance, or what have you. As we'll talk about today, it really is about kind of outthinking the competition a little bit too, that especially as you look at some of the more modern types of techniques that we have, we can be very targeted in our approach and very cost effective and actually be able to demonstrate a return on investment for our marketing efforts.
All right. So we're going to talk in making that transition from the old way to the new way. And a lot of you may be doing some of these things already, and we can help you take that to the next level in our discussion today. So can I have the clicker?
I'm sorry.
Thank you. So let's get started. So obviously your traditional media, the evolution of marketing, right? You've all seen these. We're still doing them. They call it the marketing mix for a reason, right? It still has a place in rural, by all means. I'm not telling you to dump everything traditional. Absolutely not. You've got a great relationship with your local radio station, and they've given you a number of spots. And when you get your market research done, and they tell you, your citizens are telling you, we want to hear from you in the radio, for example. In my particular market, that very, very much worked. And we had one radio station in town for several counties. So it very, very much works. Yellow pages, I've been trying to convince. If there's one I could convince my clients to stop, it'd be this one. But outside of these, there's definitely a time and a place for all of these. And I'm not saying don't get rid of those. Okay, so there we go. So let's talk about what you should be doing now, and you may be doing some of it. So PPC is your pay per click advertising, and we'll talk a little bit more and define that a little bit more for you today. Your search advertising, and there are different ways to do it. Mobile advertising, social media, email, streaming video and audio. These are all things that we're going to talk about in that digital mix. And they're way more at your fingertips than you think they are, and can be even more affordable than your traditional advertising and give you amazing metrics to move the needle. So we don't want to get stuck in the traditional rut, the definition of insanity, right? So, and for some of our C-suites, they might see it, we've always done it this way. We're maintaining our volumes. Maybe we've seen them dip a little bit, but we're doing all right. Or you've got the orthopedic surgeon who insists on a billboard because he wants his face on every billboard within a 50-mile radius.
Lots of laughs, I think that might be.
As a marketing director, you get those, right? You're in the bathroom and someone next to you in the next stall goes, hey, I need a brochure for this thing. Oh, okay, yeah. Let's talk. So talking about getting out of that traditional rut, that's our whole thing for today. So hopefully you'll get some key takeaways. So let's see how you're currently doing. So by raise of hands, how many of you know you are doing some digital marketing at your organization today? Okay, let's see how well you're doing. Okay, I want you to get out your phone. I'm asking you to get out your phone and be completely distracted. No, don't go into your emails, but go in and Google search your hospital. Okay, please go in. Don't go directly to your website. Don't click on that link. I want you to get to the Google search. So you can use Google Chrome if you've got that on your phone, Safari, but just type in your organization's name. Don't click on the website, because that won't automatically happen. As from your organization, you've probably been clicking on that. So you should get to a screen that's going to look like my next one, but you should be seeing stars, which is a good thing right now. So this screen up here is an example of what you should see on it. This would be more of a desktop view. But this shows you what your Google review would be. So for Tri-County Healthcare, they've got stars, which is good. They've got a 4.5 star rating, which in rural is pretty exceptional. You want to be at 3.5 or higher. Google wants you at 3.5 or higher for your SEO, your search engine optimization, to keep you at the top of the fold and have your organization be up above other healthcare organizations in your region. So that little information bar to the right on the screen there's a picture of your facility. Have you checked out what that facility picture looks like? We actually had a client whose picture was a gas station located next door. So it's really important that you're constantly monitoring this, because this is your Google listing, your Google My Business, and you want to make sure that you're monitoring this with every single campaign that you do. And you want to make sure that you've got, number one, a star rating. The more reviews you have, the better. So Google's goal is that your patients are going to just click and get the information that they want in that right-hand side of that screen there. Their goal is to get it to a zero-click rate. They want a 100% zero-click rate, so that every time that they are providing information, they're giving pretty much everything you'd need to know in that little snapshot. We do a lot of things in marketing that we want them to click through that. So it's really important that we get that information in there that will entice them to click more, give them more information about different service lines you offer, all of that good stuff. So Google My Business, we really need to focus on that. We'll give you some tips on that too. But the more reviews you have, the more content you have. Google is monitoring that content all the time. So if they want to be at 100% zero click rate, where no one ever has to go to a website, I find it to be an interesting goal. Do you have any idea what rate they're at now? Anybody want to take a guess? They were at 60% by the end of last year. Zero clicks. Don't go to your website at all. So they are controlling that information. It's all content-based. So your website, your other front door, also a very, very, very important tool in what pops up on that right-hand side of that screen. Your social media links are also there. And if you've got a good connection, you've got people engaged, they'll have the links to your Facebook page and Twitter and all of that stuff available too. So the online star ratings are important. Responding to the reviews that you see. Some institutions have great workflows for this, and they're constantly monitoring those reviews, good or bad. They're monitoring those reviews and responding. Some of you probably maybe haven't even seen a review or reviewed any of those. That's really important that you respond in a timely manner and that you're doing something with that information, and in the end, it makes your patient experience better. And we're going to talk about some ways to leverage those reviews today. So we want to make it as easy as possible for people to share their experiences. So you can obviously do that through your website, through maybe a contact us form, link to your Google review and ask them to do a review directly from your webpage. An email. Do you have an email for your organization? Excellence at whatever your organization's email is, and someone's monitoring that. Yes, are you going to get emails that are, hey, I've had explosive diarrhea for the last 7 days. Will you please help me? You may get that. You have to have protocols in place to get those messages. Even though we advise them not to give us health information, it may still happen. But at least it's another touch point for your younger generation specifically, but everybody's using it. It doesn't matter your age. Social media, Facebook, YouTube, Instagram, LinkedIn, those are all connections that Google is looking for and what the engagement rate is of the people that are out there looking at those things. So it's really important that you're constantly monitoring those too. And I know in a lot of small organizations, you may have one marketing person, maybe you don't have a marketing person at all, but someone that's out there listening to what those experiences are, and then also leveraging those and sharing those stories in lots of different ways. And and I'll go back to the screen here on the bottom, this is a little ad that we had produced. We heard it directly from the horse's mouth kind of thing, with patients that would give phenomenal reviews of the providers. And you can use those graphics, the copy's already written for you. It came directly from your patient. So it's a really easy way to build some good graphics for your social media posts. All right, so let's talk about transactional to to relational, because the other thing about traditional is it's very transactional, where digital has a way to be more relational. And that comes back to those online reviews and all the things that your patients are already saying about you that you may not know, good or bad. So let's talk about that. Transactional is your sick care. We're here when you need us. You don't feel well, you give us a call, you show up in our ER, you're in the waiting room. We might have posters in there for you, or maybe a running PowerPoint screen of things when they're in your facility. They take the doctor's orders, they go back home, and we serve that need. Relational is more on the well side. So having screenings available, that could be through your EHR, screenings that they fill out before they even arrive in your office, or maybe some online health risk assessment tools, some research, convenience. They're researching you before you get there, right? Over 80% of people go online to look for healthcare information before they get there. You go to WebMD, for example, and you put in your symptoms, and half the time is cancer, and it's just a cold. But anyway, sorry.
Amy, would you say too that on the relational part kind of supports more of a population health management approach as well? So.
Yes, that's a great point. Yeah. And this is also great to tie into your community health needs assessment and putting out information that directly ties to that information that you've received from your community for that. And looking at your hours of operation and how convenient can you possibly be with telemedicine, scheduling appointments online. You're really looking at the person versus what's making them sick or whatever their physical ailment might be. So one of the things that digital also helps us solve is on the consumer side, they can ask questions. Price transparency, we're all very familiar with that new legislation and how we're trying to meet the specifications of that law. They shop around, they're gonna go look at provider reviews. And if you don't have your providers who have a Google review listing, I would recommend that be one of the things that you go back and work on. It's gonna help your Google search results, and it's gonna help those who are consistently shopping around. They're far less committed, they're less loyal, we know that, right? And digital can help bring that loyalty back. Let's look at all the things that are available in our community, what providers are available, what services are available when they're doing that search. And then the reviews. It could be for your organization, it could be for your providers. You might have several locations, like maybe you have 3 clinics. Have a Google review for each clinic. The more, the better. And I know it's one more thing to do. At least start with your organization and then go from there. Get one for your main page. Make sure that what's out there on Google is actually correct. Like the gas station photo, for example, phone numbers, hours of operation. Make sure that all of that stuff is correct. So when they are looking and making that choice, they're getting the most accurate information.
I just want to add a point too, and I know Amy covered before, in terms of the different types of digital, whether or not, it's pay-per-click or what have you. And one of the things that I notice a lot in working with customers is that if we don't have a complete understanding of what digital is, and believe me, it's evolving all the time, right? It's changing all the time. But there's an assumption that, it's social media. We do social media, and as we're talking about here, social media has its place, no question about it. Some ways it's actually to help kind of push out some of the other content that we want to push out. But as we talked about, just kind of keep in mind as we're talking about all these different things, and we're talking about these reviews and how they're getting out. And we didn't go into a lot of detail on it, but the digital component of this is, there's other aspects of this, from search engine optimization to what are our keywords on our websites and all those sort of things, how people are searching for different information, and then how we're targeting them through different advertising that we have. The same kind of concept that, when you're going and you're, let's say you're going to go buy some shoes on Zappos, okay? It's not as you very well aware, it's not a coincidence that you're getting, those ads that are coming up. And so there's a lot of strategy behind that as we look at, how we kind of make our digital footprint even more sophisticated.
Mm-hmm. So let's play a little fact or fiction. So on this next slide, television advertising is not cost effective and it has too much waste. Fact or fiction? Okay, totally depends. So especially in my rural area, we have one cable provider. It's extremely expensive. And when we did a little bit of research in our area, we noticed that streaming TV was super popular, especially with the younger market. And that is how they were getting their news and watching the local sports and all of, and I mean, let's not even talk about all the other streaming that's out there. Netflix is now also talking about opening advertising on their platform. It'll be everywhere probably. Elon Musk and Twitter. I mean, it's going to be exponential. But with streaming ads, they're way, way, way more affordable and way more targeted for your rural area. So streaming has some serious advantages, and we're going to get into that even more.
And I can recall someone who was a client of mine once, you. And do you remember the conversation about at Black River Falls where I was trying to convince you that we need to do television advertising, and at the time, and you were right, you had said, this was before all the streaming and all of that, that there was all the waste and everything, and now it'd be a completely different perspective. And this is something that I find is fairly common as well in terms of just kind of that misunderstanding. And there's and we'll talk about it here, but there's other types of streaming outside of television as well in terms of all the different radio programming and such as well. So.
Yep. Video's king, and I know that can be, just to produce a video can be really expensive if you go with a big formal company. But I don't want to steer you away from that. There are definitely ways that you can produce a video at a lower cost. There's stock video out there, and I know we like to customize a lot of things for rural because everybody knows everybody in our rural community. They know the mailman, they know your local provider, and you want to put some of those faces in there. There are ways to do that and kind of mesh the two together, meshing stock with your custom. But there are so many versatile uses of producing a video. Let's say you do a 4-minute video to explain, this just beeped at me, I don't know what that means. Probably too much hand talking. When you produce a video that's 4 minutes, you can break that down into several little components and target specific keywords in the search to tie directly to that video. Most advertising, over 80%, they're projecting to be, that's how we're going to market. I think TikTok is exponentially, oh my gosh, I'm having a hard time with words all of a sudden. Lunch coma has magnified that. But you can use those videos on your website, your social media, your YouTube channel, the streaming platforms. So you could get so much more bang than you would out of a commercial that you would, 25 years ago, just run on a TV channel. And because you can do so much more targeting with zip codes and lifestyle and stuff like that, you can really, really get some really good bang for your buck out of that. And it's not as scary as it once was. So, and we're talking streaming, we just wanted to show you where that kind of ends up. The blue is all paid for. You can buy into these media. The red at this point, you still cannot. But there's a lot of avenues there that you could pursue with a local media company or a good partner. So here's an example of an ad that we did for a TV commercial that we also used in all kinds of other formats.
Life, it's a balancing act. Between trying to keep up with the kids and making healthy choices to facing today's challenges head on. When it comes to your health, where can you go to get the whole picture? Edgewater Health. We can help you care for both your emotional and physical well-being. Because with Edgewater, a healthy mind and healthy body equals a healthy life. Edgewater Health, for your whole life.
So there was just a little bit of custom in there and the rest was stock, and we were able to produce a video that we're going to be using across several platforms. It was a great team effort, and you can personalize it obviously with your branding and your logo and all of that good stuff. So it makes really good sense to look at that if you haven't looked at it yet.
Right, but the point is you don't have to have all original video or anything as well. Yep.
Yeah. All right, we just keep placing the same media and market because that's what we've always done. I'm sure you've never heard that at your institution, and you always come back with that's fact, right? No. Right?
Hello.
No. And I know that we can be somewhat committed to our local reps and they'll pop in and it's really hard to say no and all of that good stuff. But again, definition of insanity, we can't continue to do the same things over and over again. And having a partner who can really look at your entire mix without, if you have a radio rep, they're obviously going to place that first in your mix. If you have a cable programmer, they're going to look at that first. You really want somebody who can look at the whole picture. And being able to have the metrics associated with that. So that takes us into this next slide, and with the metrics that we can associate on certain campaigns that we've run, this is a way to move the needle. Digital, you can actually see the needle move too. So here are some examples. We've got primary care, colonoscopy, orthopedics, all campaigns that you may have run in your own market. And just the data that we've been able to produce, we'll look at the primary care one. I won't read the whole slide to you, but let's look at the primary care one. Remember, your website is your other front door. And it's really important that you're constantly updating your website, looking at your landing pages, making sure that that information is still accurate, working with your departments within your facility to make sure that that information is still correct. And that we had over 9,000 visitors. And at one of the clinics alone, the page traffic went up by over 11%, or 13,000% in 1 year to the next. And they weren't really looking at primary care. It just wasn't something that was on the radar. And now we know this is what people were looking for. And we know it because we've got the data to prove it. Where do we get this data? Google Analytics is one source that you can use, and it's free. If you haven't set that up at your institution yet, please go do so. That would probably be one of the other big things I would do. And not only, if you've already got it set up, are you looking at it? Quarterly, start out with quarterly, monthly. You can have the reports automate into your inbox so that you can review those and know that, oh gosh, 70% of my people are coming through their iPhone to my website. Have you looked at your website on your iPhone? Most people haven't. Or because what the page looks like on your computer, where we're often constructing it, looks very different than how it looks on your cell phone. Another good thing to go do when you get back. All right, take it away.
All right, sounds good. Thank you, Amy. So as I'm just going to walk down here a little bit because the light is in my eye reflecting off of my glasses, so I can see a little bit better down here. So, so Amy was talking a lot about analytics, and so, we look at all of the different strategies we're talking about, and ultimately, the goal of marketing is to build volumes. It's to increase business, is really what it comes down to. I mean, yes, there's a function in terms of building a brand, but ultimately that's to build business. So that's so how do we know if our marketing is effective is because we have to have established goals and then know whether or not we achieve them. Now, when we look at some of the goals, for instance, that Amy shared there, and you could see from some of that data that there were some analytics that were focused on certain types of digital measurements, like, how many people went to a website or how many people hit it, things like that. But there were also measurements about certain things like volumes, how many new visits were generated, those types of things. So as we talk about developing our marketing plan, we have to have that basis for that. And so when we talked at the beginning about, well, there's a role in digital marketing and there's a role in traditional marketing, there is, but it's not one fits all. There are many things where you don't need digital at all. Some things where you don't need advertising at all. A lot of things as you kind of go through and you develop a marketing plan, and we all know that there are a lot of issues that are outside of, maybe there are referral issues or there are customer service issues or whatever they might be, things that we need to look at and look at what kind of barriers to entry do we have in order to know whether or not, marketing would even be effective. So when we say here, this revolution starts with strategy, and I'm going to kind of just highlight a couple key takeaways here. This is a process that we go through. What's more important is that you have a process for yourself, and that you think, and you just have you're thinking this through. As I mentioned before, a big component of this is, do you have a strategic plan? Okay. Ideally, your marketing plan is built off of your strategic plan. So in essence, if you kind of look at, there's different ways in which you do your strategic plan. But if you have the style in which you have pillars, for instance, and you have a growth pillar, for the most part, I look at marketing and business development as kind of extending off of that growth pillar. Now, marketing can affect other things as well in terms of maybe, parts of employee relations or quality scores and things like that. But generally, it focuses off of that. So as clear as possible as you can have that to kind of know what direction, okay, we're trying to increase our surgery volumes by such a percent, or if you're fortunate to have other, specialty surgeons that are coming in and keeping your surgery suite busy, what are those specific goals, and having a better understanding of that. So when we start to work with an organization, just to kind of give you an idea, and again, the idea is that you just have something that's similar that works for you. But the first part is gathering as much knowledge and information as possible. So again, as I kind of mentioned, there are a lot of things that affect whether or not marketing is going to work. There are things like, for instance, what are our quality scores right now? What are our patient satisfaction scores? Obviously, what are our financials? What do we have certain public relations issues we need to be aware of? Hello? Do we have any kind of, just issues in the community that we need to work around? There's a lot of things where we might enter into a market, and there's some things that kind of need to be fixed before we do that. We generally do that through interviewing of different folks, different people at the C-suite, different people in the community, what have you, and then compare that, by the way, with what are your competitors doing? And I would say just a quick takeaway on that is that, I'm sure it's hard for many of you to do this if you're very visible in your communities, but I would just encourage you to have someone, whether or not it's actually walking into a competitor's facility or, taking an assessment of what kind of materials are out there and seeing what they're promoting, what their messages are, things like that. Again, it doesn't mean that you're going to copy your competitors and they may be doing some things that are actually wrong. But I think it's just a healthy thing to just kind of just know where they are on things. So anyway, so then we take all that data, and then the second stage here we talk about is the diagnosis. And this is where kind of just start to put all this together and, how does all this work? What kind of learnings have we had from it? Do we need to do any additional research? The research could be anything from a quantitative study to measure, perceptions and likelihood to use, or even preferences of why a particular patient may or may not use your facility or use different services. I'll hear a lot of, we'll start to work with the organization and they'll say, we just need to increase our awareness. We just need to make people more aware of it. And there's this assumption that if we do that, they will come. Well, it's the case in some cases, but the key to marketing is finding what we kind of call where preference and awareness come together. So in other words, you can be very aware of something, but that doesn't mean you're going to prefer it, right? You could be very aware that yep, that hospital is there and they provide, ER care, but there's a reputation in the community that it's really poor care. It affects the whole, reputation of the organization, so you're not going to go there. So that's where effective marketing comes into play as well, because it's not just doing, okay, we're going to do this ad or we're going to do whatever it might be. It's really understanding from the work that you've done in terms of what would be an effective message. What's going to be more likely? What's going to convince people to kind of take some kind of action? So I could talk about that forever, but just to kind of give you an overview of that a little bit. So, and then it comes to the treatment plan, which in essence is the marketing plan, okay? And this is what I'm going to just focus on a little bit more here. And so in essence, the marketing plan is kind of what you would think it would be in terms of, okay, what are we going to do and how are we going to accomplish it? But more specifically, it needs to have measurable objectives. Those measurable objectives can be based on certainly things like volume, obviously, based on profitability, could be based on market share, all kinds of things. And then part of those metrics are the things that we talked about in terms of some of the actual metrics in which we're knowing whether or not our activities were successful, how many people went to a website, those types of things. So you form goals on each of those. Now, part of that is when you form those goals, there may be areas where maybe you're not successful. I mean, part of successful marketing is to evaluate what works and what doesn't. And if something doesn't work, to make sure that, as Amy kind of mentioned, that even when it comes to something like Google Analytics, that you're routinely looking at that data. Because there should be anything else in your organization where you use data as a management decision. So, okay, yep, that worked well, great. But you know what? If it didn't work, let's talk about that too. Why didn't it work? Was there did it have anything to do with the advertising? Did it have something to do with an issue that you have in your organization? Was it, what was the reason? Let's dive into that a little bit more and understand that, and then correct it from there. So as we look at these objectives, I think it's more unique in rural healthcare, but healthcare in general, we're asked to be everything to everyone, and we have limited budgets, and everybody wants advertising. Everybody wants a campaign. Amy was mentioning before, you might have more influential physicians who are saying, I want to be on the billboard, what have you, okay? So this is about developing a process that it's not perfect, but it works pretty well. And it kind of, in a way, is more of a scientific approach. So it's actually a way that we've been able to kind of bring physicians more on board with it. But what it comes down to, I just need to get a drink here, sorry. Could you grab my water there? What it comes down to is thank you, is as we're looking at, for instance, various service lines, we know from our marketing that, okay, we have all these things that we want to market, and we don't have necessarily all the resources to do it. But let's figure out, how are we going to determine where to allocate our marketing resources and where not to? And part of that is doing a prioritization exercise. And I'm kind of just hitting the overview of it right now, but it's looking at a lot of different criteria here. And you can see, anything from, does it build community image? Is it market ready? A lot of times we're asked to market something and it's actually not ready because there's not capacity really yet. There's a 2-month waiting list or whatever it might be. Is it profitable? Of course. But maybe even if it's not, is there downstream revenue that we should be thinking about? What kind of market potential? Do we have a differentiation in the marketplace in some way? Is there something where we can maybe capitalize on a competitor's weakness? So there's a lot of different factors, and you may look at that and say, yep, those are all important. But part of the exercise that I would just encourage you to do as you're thinking about those prioritization is some of these things may be more important to you than others. And so you have to kind of look at, how do you weight those? So as an example, there might be in your community, maybe you're overcoming some kind of a public relations issue. Well, image is going to be the top thing for you before you even do some other things. So, and not to get into all the detail, but there's an exercise that we go through where we actually take these criteria and we weight them and we give them a number and all of that. And then we put them into what's called a tier. And the general concept behind this is that, again, you can't be everything to everyone, okay? But how can we do a limited amount of things or a finite amount of things and do them very well? So the idea is that if something is in a tier 1, it means that as you went through that prioritization process, that if it's in tier 1 occupies 60% of all of your resources, whether or not those resources are your time or your money. And theoretically, there could be, for instance, maybe only 4 things, as an example, under tier 1, and there could be 10 things under tier 2 and 10 things under tier 3. So as you look at that, and it helps you to kind of focus, it helps you to form objectives, it helps you to define, it also helps you to really to justify in many ways and communicate your plan, because there are departments, as an example, let's say it's a home health department and we're really proud of what they do. But if we look at those criteria and we say, well, we're happy with what they do, but they don't really rank in the tier 1 area, but there are other areas that are going to justify those larger expenses. And it just helps us as an organization to really form those goals. So the reason that I shared this before I hand it back, the reason I share kind of this whole planning process is just to kind of make sure that we have things into perspective, that that there are different tactics and different strategies to use for different purposes. And it's not like everything, we're not advocating that everything that you do has to be digital, as an example. Sometimes it just really doesn't make sense, and vice versa. So with that, I'll hand it back to Amy to kind of finish out, and then we want to have some time for questions as well.
Oh, I don't need it right now. Okay. I do need the clicker, though.
Oh, sorry.
All right. So this is an example of a media plan that you might see, and you can see we've got some traditional on there with the radio and some broadcast TV. We've got some streaming, some online. We'd put all of this together, and we'd have a full schedule. It can include traditional and digital. It can be one or the other, but it totally depends upon the service line that you're marketing. And anyone recruiting for any positions, everything that we've talked about applies to that too. And sometimes the marketing department can be left out of that process and HR just takes care of it. Your website is another huge recruitment tool. And if you haven't looked at that front door in a while, it's really important that you're looking at, we're so good at going through our physical building every day and checking the signage and stuff like that. And sometimes the signage that gets put up, you're like, whoa, okay. But how are we doing on our website? It's really, really important. And most of our campaigns are going to lead us back to that website. And probably the biggest thing that I mentioned earlier when I was talking about my experience was with my clinical director position, I, for the first time, was really given a seat at the EHR table. I so wish I would have been included as a marketer way before I became a clinic director. There was so much that I learned that EHR could do from a marketing standpoint that I had no idea about. I'll give you an example. So we're gonna run a colonoscopy campaign, right? And they might be on a 5-year schedule, they might be on a, depending upon the results of their screen, then we would send a reminder letter out of our clinic to let them know that they've been given that. The EHR has an automatic process that does that. We were doing it all manually. And then you have human error, you miss the people who maybe haven't even been in your clinic, they've only been in your ER, but we know by their age group or their medical record that they're due. That many EHRs automatically have that already built into them. What does that reminder letter look like? I had never seen one until I became the clinic director. As the marketer in my head, I was able to change the language of that letter, brand it so that it actually was our brand that went to them, so they knew which clinic was actually sending them the reminder. And then, just some pre-screening stuff too is another example that I think of that they can fill out before they even come into your office. And then the whole requesting an appointment or scheduling an appointment online. There were capabilities there that I had never been brought to the table for. There are several examples, patient education materials. There's a lot there, and it all can be tied to your CHNA, the work that you're doing for prevention and chronic disease management and all of that good stuff. So if you haven't been invited to the EHR table, get in there, and there's some great questions that you can ask. As someone, you've been in a clinic office before, so you'll have some really good questions to ask them about what the system is capable of doing. And they may not know the answer, but they can go back to the EHR rep and say, hey, can we do this? And more than likely you can. So, and the metrics and items that can come out of there, like your no-show rates. Who's no-showing? Who's showing up in the ER without a primary care provider? Those reports you can run them. They can auto-run every single day. And then you develop a workflow to get them out of the ER and align with one of your primary care providers. Those are all workflows that can be set up out of your EHR. So get to that EHR table. So the most important piece, obviously, is your digital serves as your call to action. Most of the time, you're going to send them back to your website to learn more on that particular landing page about orthopedics or whatever campaign it is that you're running. We've tried to engage patients more, and one of the tools that we've been using is an online health risk assessment. So the example that we're going to show you is regarding orthopedics. And this is just 6 months of data. This is from July to December of last year. And we had, I think, a really cute campaign from Recliner to Recovery. And we had hundreds go into it that were linking to our assessment. We could do it from a social media post, we could do it from our website directly, and we could get the analytics to show us where they were coming from. And we had, in those 6 months, 77 people went through it completely. It was like 10 questions by the time it's all said and done. And you get some demographics on, are they female, male, what is their age group, those sorts of things. And we only got their name and email And that was all we asked them for personal information, because the more personal information you ask them for, they're going to start to drop out of your survey. And we want to keep it as quick as possible for them. 11 of those 77 converted to procedures or surgeries. So this online assessment paid for itself in 6 months, like more than, well, many times over. And then we also worked with the orthopedic department to establish a workflow for those folks that we didn't see come in as an appointment. And the orthopedic department followed up with that patient. We knew which joint was bothering them. We knew what the severity of it based off of the results of the assessment. They could have a really personal conversation with them and align with a consult. So, and we're still using this today. So just a really cool, engaging, there's lots of tools out there. This is a particular one that's close to my heart. All right, so in summary, hopefully we've given you some tools that work, things that you can go back and do right away that aren't budget killers. And yes, you might have to add another hat to your head in a small rural hospital. We know that happens. Hopefully we talked about that difference between relational and transactional, and sick care versus well care, and fitting the person, not the need. And then correlating your plan with your strategy, your strategic plan. We know that in some rural hospitals, strategic plans have kind of taken a back seat with COVID. And as you get back on that process, marketing deserves a spot at that table too. So advocate for that. And then obviously we've given you some tips and tricks and other tools that you can use with your Google listing, Google Analytics, the online health risk assessment. So hopefully you've got some more weapons to take back to your facility. So with that, are there any questions?
As someone that is a clinic director who also has the cap of marketing, in my organization, I hold a lot of roles. So marketing, IT, HR. Luckily, when you said HR and marketing, I do both. But getting our clinic managers and some of our clinic personnel into that space of marketing, do you have suggestions on how to move them into maybe not the billboard, but maybe putting more effort into the analytics or more funding into that space?
So one of the best ways to get buy-in, I started a customer focus committee, and that allowed me to get more of the metrics so that they could see them and then we could talk about them. Because until you can get those folks around the table to help them even understand the metrics, and then they're a part of the process, and they're owners then, not renters. So I would probably start there. And so you do IT as well? Oh, God bless you. Yes. And yes. The reporting is difficult out of the EHR in particular. That was probably my biggest challenge, is what are the reports available? And then how do I build them to get them to run correctly? Was another huge issue for me. But again, if you have the right partners to help with that, and we were Cerner at the time, well, they still are, but our Cerner rep was super, super helpful on trying to get those built correctly for us so that we could take those metrics back to that committee, and then we'd be, okay, so we're seeing a lot of no-show rates at this time of day or this day of the week or whatever, and then we could build the processes in, or with those particular patients, what to do to help them. So, and then they can help with the process and the workflow side of it to get the needle to move too physically. Because we didn't really talk about patient experience today. You can put all the information out in the world about how great you are, but you can't put lipstick on a pig, right? So yeah, the patient experience part is really important too. Perfect. They have a patient advisory council. That's another thing I would recommend.
Great. Thank you so much. This is really helpful and interesting from a number of perspectives. I was wondering if in your work you found generationally any surprises in the use of social media, because I'm not convinced that it's only younger people, that some of our older folks are actually quite good. And if you could comment on that and some surprising outcomes you had from that.
Mm-hmm. Yeah, most of our campaigns, especially Facebook in particular, they're all 55 and older. We're not, and most of you probably, my kid's on TikTok. She doesn't go on Facebook, and she thinks I'm prehistoric for going on Facebook, which maybe I am. But anyway, And showing that data to the C-suite in particular was super enlightening for them, because they thought, well, why do we need to go to social media? You know, who's going to go out there and look at it? And the fact that I even had data to show them, whatever the age group, you know, they might not want to invest in the website. You can show them specifically who's coming to your website even, and the demographics in your market, which zip code's even coming to our website. And that was really eye-opening for them. But I would say demographically, the zip codes were most surprising. You would think like maybe it's your primary service area. We should definitely see the most traffic out of our primary zip code. Not at all. Not at all. And your secondary service area is going to have multiple zip codes, and which ones are we hitting, and why? What in that particular area are they needing? And maybe it's a service that they would have to drive. They're in that particular part of your market where it's a 2.5-hour drive to a tertiary facility versus on the other part of our market where it's only an hour. So that was super enlightening for us too, because we just thought, well, primary is going to win every time. Not at all. Sure.
So, and also to keep in mind, your question is regarding, social media and the demographic, but also keep in mind that whether or not it's social media or other strategies, there's different approaches and different messaging for different audiences. Okay, so in other words, even if we're, as an example, and this is a whole nother session, but there's a lot of data out there in terms of what motivates obviously different demographics. So generally speaking, for instance, even we know that, for instance, when it comes to, an older generation, that they're more loyal. They rely more on the recommendations, for instance, of what their providers say, whereas maybe different audiences are going to focus more on the convenience and the choice and those types of things. So it's also just making sure we have those unique messages either within our social media or within our digital marketing overall. Other questions? None? Okay. Well, good. Well, thank you very much. I hope you enjoyed it. I hope you found it helpful. Thank you. And if you have any questions as well, we'll be up here for a while afterwards. Otherwise, we'll be back in the conference. So enjoy the rest of the conference. Thank you so much.